What can I do about my lip? It makes my smile unattractive. My whole life, my smile has been ugly, so when I turned 15, I decided to get braces. Afterwards, my smile was still not the best. I think it's because of my lip. When I smile, the lower right side of my lip isn't as full as the left side and pulls down more. What do I do?
Thank you for your question. You submitted your question with two photos, both of which are with you smiling. And you describe in your question a concern about the attractiveness of your smile. And although you had undergone orthodontics and gotten some braces, you are still concerned about an asymmetry in your smile, and in particular what appears to be a pulling down of the lip on the right side. And you want to know what you can possibly do. Well, I can certainly share with you how I would approach a situation like yours, of course, without the benefit of a full physical examination, but just by reviewing your photos. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, helping people improve the appearance of their lips is a process that we do in our practice every day, and it is an area of focus that's very, very important for a lot of people to have confidence. And I think certainly it's important to pursue optimal appearance, but at the same time it is important to recognize that nobody is 100% symmetric. And I always tell my patients who are very focused naturally on maximizing symmetry that we are beautifully imperfect and that everybody has a little bit of a difference from one side to the other. But I think what we can do is certainly get a little bit of understanding of some basic principles that I apply when evaluating patients for lip enhancement. So one issue which you raised in your question had to do with volume. So when we look at someone who is relatively young, we naturally understand that this is a genetic appearance. When we look at someone who, as they're aging and there's volume loss, well, that's an age-related volume change, and the approach is more about a correction. When we're looking at someone who is younger, we're looking at essentially an augmentation. And it depends on the degree of volume that is potentially can be beneficial. And the art is in really being very, very strategic. And a lot of times a little bit goes a long way. I'm not saying that that's the right thing for you, but it's just important to understand the distinction of where volume may play a role. Now, when we look at lips, there's a certain golden ratio that we often apply to the aesthetics of the lip, and if there is a volume imbalance which could be enhanced to achieve something closer to the golden ratio, that's where volume has augmentation has a role. Now, the other part of the equation, which I think is actually more relevant in your situation, has to do with the action of certain muscles on the lips. And there's a particular muscle that I think is relevant in this situation, and that muscle is called the depressor anguli oris muscle. And this is a muscle that in the dynamics of lip movement actually pulls, like a pulley, down the lips down. And so when I ask someone to show me the strength of that muscle, I ask them to actually show me their lower teeth. And what happens is they bring the corners of their mouth down, they show me their lower teeth. Now, it is not unusual for people to have an imbalance between the two sides. Well, to help patients improve the balance as well as do things to, for example, change the downward appearance of the corners of the lip to more of an upward appearance, we do something called a Botox lip lift. And that means applying this principle of relaxing certain muscles like the depressor anguli oris to allow the lip to travel upward. And it can have a very, very nice impact. Now, the benefit of trying an approach like this is that you can see if you like the results, and with a drug, a neurotoxin like Botox, it wears off. So if for any reason you're not exactly overwhelmed and happy with that outcome, well, it wears off, and then you can just maybe put this on the shelf. But I would say that this is an opportunity to consider doing something that is minimally invasive and seeing if a little bit can help you feel a little bit better about the outcome. Now, again, I always stress to my patients that when people look at themselves, they see things that they don't like and they tend to magnify them or amplify them, while the rest of the world sees the big picture, sees the whole face. And so I think that, of course, it is important to do things for yourself that can help you feel more confident, but it's also important to have perspective, to recognize that if you ask some of your closest friends, have they ever noticed this particular attribute, they probably would not mention it as something that was significant. Some may notice it, but I would assert that often most people would not notice, and that's just human nature. So I'd say that if you are interested, meet with qualified, experienced doctors who can offer you some options, and I would say try to be conservative first. And I think use of Botox strategically is probably a conservative first step that may be what can help you achieve this goal. Understanding, of course, that Botox does wear off, and therefore you will need to do this on an ongoing basis for maintenance if you are so inspired. So I hope that was helpful. I wish you the best of luck. Thank you for your question.